On the island of Ireland, just a few hours' drive can be the difference between a healthcare bill for thousands of euros and a bill for zero. So what's going on here? That's what we're going to break down today.
Okay, so to really get our heads around this huge difference, we're going to follow a hypothetical family. We'll track them through a totally typical year of healthcare, first in the Republic of Ireland, and then we'll see what happens in Northern Ireland.
All right, let's start our journey in the Republic. We've got a family of four, two working parents, two kids, and they're in a really common spot. They earn too much to get a government medical card, which would make care free. For them, a lot of services are going to come with a price tag.
Okay, first things first. We've all been there, right? The routine trips to the GP. You've got colds, the usual checkups, minor illnesses. It's just a standard part of any family's year. So in the Republic, you've got this mixed public-private system. And what that means for our family is that each doctor's visit comes with a fee. A single visit might be 60, maybe 70 euros, but boy, does that add up over a year for a whole family.
Okay, so what about prescriptions? Let's say one person in the family needs some kind of ongoing medication. In the Republic, that's handled through something called the Drugs Payment Scheme. Now, the good news is there's a system in place to stop these costs from spiraling out of control. There's a cap, so no matter how much medicine they need, a family won't pay more than 80 euros a month. But still, that's a fixed cost, every single month, coming out of their budget.
All right, but life happens, right? What if something a bit more serious comes up? Let's imagine one of the parents has an unexpected issue and needs to stay in a public hospital, just for a short time.
So even though you're in the public HSE system, there's a charge for every night you stay in that hospital bed. Now, it is capped at 800 euro for the year, but for an expense that comes out of nowhere, that can be a pretty big financial shock. So let's tally that all up. You've got the GP visits, the monthly prescriptions, and that unexpected hospital stay. And just like that, our family is looking at a bill of over 2,000 euros. And remember, that's without any private insurance. Okay, now for the interesting part. Let's hit the reset button. We're going to take the exact same family with the exact same health issues and just move them a few hours up the road to Northern Ireland. Let's see how their year plays out there. And this is the absolute game changer. The system itself is fundamentally different. Northern Ireland uses the UK's National Health Service, the NHS. It's paid for through general taxes, and it's built on this core idea that healthcare should be free whenever you need to use it.
Right, so remember those doctor's appointments? The kids still get sick, the parents still need their checkups. Nothing about their actual health needs has changed one bit.
But the cost? Well, take a look. As residents, every single one of those GP visits is completely free. Zero.
Okay, so what about the other stuff, that regular prescription and that surprise hospital stay? How do those costs stack up?
And this right here is the NHS model in action. Both of them, the prescriptions and the hospital treatment, are completely free for residents. No monthly cap, no nightly charge. The cost is just zero. All right, let's put this side by side. Let's look at the real financial impact after one identical year of healthcare, just on different parts of the same small island. I mean, look at that. The difference is just massive. We're talking nearly 2,500 euros in the south versus basically nothing in the north. It's the same family with the same health needs, but a totally dramatically different financial outcome. So why the huge gap? It really all comes down to a different philosophy, a different way of thinking about healthcare. The Republic has a system with charges and means testing for many, while the North has a tax-funded model where being a resident is your ticket to care. But, it's never just about the money, is it? The final bill doesn't tell the whole story. There are other really critical factors, like how quickly you can actually get the care you need in the first place. And this is where we get to the big trade-off. See, while the NHS gives you that fantastic predictability of near zero costs, both systems can really struggle with long waiting lists for non-urgent care. In the Republic, that has pushed many people who can afford it to get private health insurance, pretty much for one reason, to jump the public queue and get treated faster. And that really gets to the heart of why this matters. For so many working families in the Republic, healthcare isn't just a background cost covered by taxes. It's a real, tangible, and sometimes unpredictable line item in their family budget, and it directly affects what money they have left over at the end of the month. So it leaves us with a pretty big question, doesn't it? Both systems have their challenges, especially with those waiting times. When you think about your own family's well-being, what's more important in a healthcare system, the financial security of a low bill or the ability to pay for a shorter wait?